Oh, all right. We are live. Well, first of all, thank you. Really appreciate it. And welcome from San Diego. Really appreciate being here. To be frank, VSP is a big company with, we do a lot of sales, a lot of business. It's so important to work with the brokers who are on the, boots on the ground talking to clients. So we really, really appreciate it. We would not have the success that we have without working with all the folks that do the distribution for us. So thank you guys for the time. This will not be very long, 15, 20 minutes. And my goal here is really to talk about the value proposition of individual vision for you and for your clients. So where does it fit? What's the space for it? How does it make sense for you and your clients? I'm not going to do a super deep dive on lens enhancements and things like that. So thank you in advance for that. We're going to dig in here, and these are the things that we're going to cover up front. And we'll take some time to walk through these, but really from the high level of, why bring it to them and what's the value for you. So with regard to vision care, it comes up a lot of, why do I want to bring this to my clients? What's the value? Very importantly, there are millions of folks that have a visual impairment. Many of them are at risk for, vision loss or other health conditions, but aren't seeing a physician. So there's altruistically a important healthcare need to have your eyes examined and to get your well eye exam. There's lots of folks with visual impairment that would benefit from a vision product. Interestingly, this is something that a lot of people don't know, is the routine eye exam often is the first place that people find out about some of their other comorbid conditions or other health risk factors, things like diabetes, hypertension, high cholesterol. Those can be seen and detected on a routine eye exam. So many times folks go in for a routine eye exam, the optometrist tells them, hey, you've got some, issues. You're showing maybe potentially some signs of diabetes or hypertension. So it's really, really important from that perspective that you may actually be getting them into their primary care physician because they caught something on a routine eye exam. So good reason to bring vision care and making sure that someone's getting their routine or annual eye exam, especially as they get older, over 40. Now, from your perspective, depending on what niche you're in or where you sell, there's a lot of folks that kind of fall through the crack. I would say individual vision is sort of a safety net for vision. So we're catching the folks that fall through the cracks. You've got people that are retiring early, so they're not eligible for Medicare. So they're in that gap. They're 63, 64. You've got folks that are now on the exchanges. They're in the marketplace. They're not being offered benefits from their employer. They're part-time 1099 employees. They're kids rolling off their parents' coverage. So there's all these people that are kind of falling through the gaps. And as we know, plan sponsors or employers are less and less excited about managing benefits, and more people are, moving into some other spaces where they're having to find their own coverage. I think this is going to be more common as time goes on, but this is a chance with individual vision to catch those people that don't otherwise have coverage. So lots of targets. I would say as a broker, if you sell ACA, adults aren't covered in ACA products, and if you do any Med Supp at all, Med Supp folks don't have it generally. And in some of the MA products, the product's really skinny. There's very little coverage. So there's these pockets, depending on where you sell, where it might be a great idea to talk to them and ask the really simple question: do you wear glasses or contacts? And I realize that when I talk to folks, brokers, and when I talk to people who sell on the exchange, the advisors and supporters that do that for consumers, they don't often ask their clients, hey, do you wear glasses or contacts? That's the simplest question to ask up front to find out if they might be a candidate for individual vision. Now, specific to VSP, if you're not familiar with the brand, we cover 85 million people. We are not for profit, so we are solely focused on member satisfaction and quality. So that is literally all we do, is focus on making sure the experience is good. So great brand. Most people will know the brand. Also, it is a fairly low cost product when you look in the scope of services, and certainly in ancillary, it's not a very expensive product. It also fills some gaps, as I mentioned, covering vision where original Medicare A and B don't cover it. Access is fantastic. I'll get into that in a minute. I mentioned the marketplace, and also there's just some flexibility and ease of buying an individual vision program, and we'll talk about that in a second. So one thing that comes up a lot, and anybody who's sold healthcare understands how important network is. And my experience is more on the health plan side, where I worked with a lot of health plans. And when you start getting into access, it's always a huge thing, especially with seniors. If their doctor isn't in network, or they have challenges finding services, they're not happy. One great thing about VSP is we have a huge national network of providers. And my understanding is the agents and the agencies here that are watching this are all over the country. So the good news is we have tremendous coverage. It will not be hard finding a office practitioner or an access point to seek services if they buy this product. So it's primarily made of independent practice practitioners, optometrists. We have also bought VisionWorks, recently added iMart Express. So there's kind of two retail chains that are more in retail settings than private practice settings. And then Iconic is an online retailer. So someone can get their eye exam and then get the materials fulfillment through an online process. And as we know, especially following COVID, people have become more and more comfortable with online solutions. So we really have the access points covered. That should not be an issue. And if it is an issue, it's probably because there's just none in that area if it's somewhere super rural. And that would be the case no matter who you're working with. So just real quick, I want to cover that because I think access is such an important point, especially if you're supporting a member, a client. Really easy to find the practitioners. So there's a locator tool on our site. And when someone buys a product, they get a welcome packet, gives them everything they need to know about how to seek services. And you can simply go on our locator tool, type in your zip code, address, whatever it might be, and all of the options will come up. It'll give information about the doctor's hours, languages spoken, experience. So it's all right there, really easy to find a practitioner, and includes retail as well as the private practice practitioners. There's also some value adds. So everyone who buys an individual vision product through VSP, there's some additional value adds that they get just as part of it. So there'll be discounts on different products and services that they get back, including when you get into the senior space, the hearing aids. And I have one specifically about True Hearing, where we have a partnership with them, and anyone who buys one of our vision products gets access to this, and it's pretty significant savings. It's out of pocket for them, but there's a pretty deep discount on the product itself, batteries and other assets that are part of a hearing benefit. And if you're talking about somebody who's over 50, certainly into 60s, many folks have had some hearing loss and might benefit from access to hearing aids. And True Hearing is very aligned with VSP, super high quality, really great member satisfaction. So they get that as a value add by buying a VSP product. So that's just kind of a throw in. Now, with regard to the plan, so we'll talk a little bit more about this. This is from your perspective, I did provide some value proposition points of why bring vision to your clients, and those include things like getting to talk to your clients maybe off cycle, because this can be sold year round. So it may give you a chance if they were super focused during AEP on their health benefit. It's now Q1. They didn't buy any ancillary. Now's a chance to talk to them about dental and about vision. So it keeps you in front of them. More products in place helps you. The more stickiness there is with how many products you brought to them, there's value. One thing with VSP, it's quiet. You won't get calls about it. People are super happy. We manage the renewals. You don't have to touch it. It provides, it's a high quality product. It's a brand name they're going to know. So there's a lot of reasons to bring this to them. One kind of aside is this is not a single rate nationally. So the way that we price this, it is a state-based rate. So as long as they're 18 years old, they could be 18 to 100 years old to buy this. There's no qualifiers on rates around their health, their gender, health risk factors. It's just a state-based rate. So the plan in Texas might be a little bit 50 cents cheaper than California, whatever, but it's just a state-based rate. So once we know the state, then the rates are specific to that. It's just the way it's underwritten. They can pay annually or monthly for the plan, But if they do pay monthly, which most people do, they are committing to 12 months. So they need to keep it for a year. They can't get their glasses and then cancel it the next month. But we do allow them to pay up front or pay by the month. And then one of the questions I get a lot is, does it really make sense for them to buy a fully insured product versus just kind of pay as you go? And if you've worked with any clients who have a visual impairment and have glasses, especially if they have a complicated prescription, there's always a ta-da moment when they get their glasses at the end of the visit and they get hit with a giant bill at the end. Super common experience. The reality is, by buying a fully insured product, even after paying for it, there's still savings, there's net savings. So that comes up a lot. I just want to kind of cover that on the front side, that there is a value proposition for the member to buy an insured product versus just pay as they go, or a discount product. A lot of people, we have found, we've kind of stayed away from discount programs. The member satisfaction is not great because it's just not what they thought it was. So they pay for a discount program, they get some discounts. It just doesn't kind of turn out how they hoped. So we have found that a fully insured product keeps member satisfaction better, our retention is better, the renewals are better. Also, what we found interestingly is that richer programs tend to have higher member satisfaction, so rather than lower end ones. This is a little bit about what I talked about on the net savings. So when you start to get into the cost of an exam, the frames, the materials, some of the lens enhancements, when you start adding those up, and especially the more complicated the prescription, that's where the savings comes in. So there is value, there is net savings. Just wanted to cover that on the front side. Also, if you've done any group business at all, often you'll see that the cadence for certain parts of a vision product might be 24 months. So you might get an exam every 2 years, or you might get an exam annually, but the materials are every other year. These products are pretty rich. It's a 12, 12, 12, meaning every 12 months, they get a well eye exam, they get frames, and they get lenses. So it's what I would consider, if you've done any employer benefits, this is a richer product than what you typically see as an employee benefit. So it's really great. And it's also, it's a true year. It's not a calendar year. So if they buy it in March, it goes until the end of February the next year. So it can be off cycle. It can be bought off cycle. It's not tied to AEP. They can buy it at any time. So it gives you a chance to talk to folks, as I mentioned, in Q1, or maybe leading into AEP, as people get very heads down on their traditional benefits. Ancillary is a great time to talk to them pre-AEP or post-AEP. With regard to the plans, you will have access to basically 2 plans. In a couple of states where it's not filed, there is an alternate plan. So I'm going to go over these plans super high level, but essentially most consumers are going to have access to 2 plans, except in a couple states. Base plan is more of our entry level plan. It's a really good, it's not a skinny down bare bones plan. It's a really good, I would consider it a mid-level plan. It's got a $150 frame allowance. If you buy a VSP branded frame, you get a little bit more money towards it because we own a frame brand and the optometrists carry that. So they get a little bit more if they're buying our house brand. But it's a $150 frame allowance up to 170 plus if it's one of our frame brands. It's got some low out-of-pocket costs for the exam and for the materials. They can also choose contacts. If they're a contact lens wearer, they can get contacts. And this plan does cover the contact lens fitting. So this is really kind of the entry-level plan, although I would say it's more of a mid-level plan. And this will be great for many, many of the consumers. And then our premium plan is a richer plan, and this has a higher frame allowance. It's a little more expensive, but it's out of pocket for the exam, and the materials is lower, and it's a richer frame allowance. So if they want to buy a better set of frames, which a lot of people tend to want to do, as they're looking through the racks, anybody who's been to an optometrist, you know, there's 50 racks of glasses and they're working through trying to figure out what they like. This gives them the option to buy a nicer set of frames and also have a little bit less out of pocket for the exam and the materials. So this is more of a high-end one. The standard plan is basically the fill-in where the other plans are not filed. And there's 4 states. It's I believe it's Oregon, New York, Washington, and Florida. So this is the default plan for that. And again, this will look very similar to the base plan, but it's $150 frame allowance, $170 if it's our frame brand. Very similar, really good. One of our most popular plans, and it's available in those states. So you as a broker will have access in most states to 2 really good, high quality VSP vision products that will meet the needs of most consumers. With regard to just, kind of guiding you there, as I mentioned, the base plan is more of the, so I'm going to save a little bit on the cost of my vision product, or I'm a contact lens where the base plan is probably the way to go for folks who want higher frame allowance, a little lower out of pocket, et cetera, maybe a more complicated prescription. The premium plan's probably a better fit for them. So I would, as a broker sitting down, as you're working through your set of questions on their healthcare needs and what they need, first question is, do you wear glasses or contacts? And number 2 is, do you have a complicated prescription? When you go to the optometrist, do you tend to spend a lot there? Because then you want to push them into more of a high-end plan if that's been their experience. So just a little background on maybe where to guide them as you're sitting down with them as a trusted advisor. One of the really great benefits of this product is that we really take care of everything for you. Once you get them signed up, and it takes maybe 5 minutes to enroll in the program, super simple. We handle everything. We send them a welcome packet via email. So they have to have email. They don't need an ID card. They're loaded into the system. They're essentially eligible in about 24 hours after enrollment. So they don't need an ID card. They just walk in, give them, or make a phone call to make their appointment, get some basic information. They'll already be loaded. Their eligibility will be in the system for the provider. We do all the onboarding. We do all the life cycle communications. We handle all the renewals. So for you as a broker, you kind of set it and forget it and let it run. We're going to take care of everything for you. And because of our member satisfaction and the quality, you're just not going to hear much about it. You really should not be taking a lot of phone calls about a VSP individual product. It should be pretty quiet. So we're going to do that back end for you, which makes life easy. And again, we think the member is going to have a good experience with that. From an enrollment perspective, if it's within the first 5 days of that month, let's say you're shopping, let's say they want to use it immediately. So it's November or December. If it's in the first 5 days of the month, they can basically backdate to the 1st of the month. If it's after the 5th, they'll have to go the 1st of the next month. So if it's November 6th, their first available date would be 12/1, or they could set it for 1/1. They could move it out 2 months to the live date. So you have some flexibility on that, but it's maybe a 5-minute enrollment, some super basic information, really, really easy to enroll someone. I mentioned a little bit about some of the touch points in the member communication. One of the things that we've learned is with regard to retention and satisfaction, it's important that we touch them, that they see the value, also that they use the program. It's really interesting coming from, I did a lot of health plan work in a prior company before this, where I did many of the embedded products in like a Medicare product or whatever it would be, where you'd see utilization in the single digits. It might be a product that's used 5% or 10% or 15%. So it's underwritten that way. Pricing looks like that. Or if you do a group product, you'll see the prices, the PMPMs are pretty low because only a small percentage of people use it. In this product, everybody who buys it uses it. So it's underwritten and priced differently. We also know that if they don't use it, they don't necessarily see the value in it. So we do a lot of touches to welcome them, tell them the value of getting the benefit, ask them to go get their eye exam, send them discounts on a second set of glasses, send them a savings statement of this is how much you'll save by getting your glasses through us. So we do a lot of touches to engage them, keep them going, drive value, but this also helps our renewals, which for you is great because you'll put it in place and commission is for the life of the policy. So it stays in place. Finally, as I mentioned, member satisfaction, super high. Retention and renewal rate, super high. So the good news is it won't be a squeaky wheel for you. You'll put it in place, people will be happy, and you won't get phone calls about it, which we think is important and something we pride ourselves on that the member has a great experience when they go in to see a VSP provider. So that is it. I went a little bit longer than I actually expected, but I just wanted to, again, thank you for bringing this to your clients. We hope that you have the same experience that we hear in the marketplace, that this has been valuable. And Kenton, I'm going to go ahead and stop sharing and answer any questions that may come up. But just in advance, just want to thank you guys for being boots on the ground and bringing our products to your clients.
Thank you so much, Michael. We do have MJ asked a question,
Yeah.
be sold as standalone.
Oh, I'm sorry. I missed the question if it was a question.
Can it be sold as a standalone as well?
It
Stand
is a standalone. Yeah. So it does not coordinate benefits. If they, let's say they have a Medicare Advantage product, you can't coordinate benefits. It is a true standalone individual product. It's a three-tier rate though. They can buy it for themselves and they can buy it for their family members, but it is a true standalone product. It's not tied into any other benefit.
And then, you were talking about uh, changeable lenses and whatnot. I know it's a deeper
Mhm.
dive. Is there something or a portal or somewhere they can contact you or to get into some of those questions if those may arise?
Yeah, they should have access to the benefit summaries. And Kenton, if you'd like, I can certainly send those three plan benefit summaries to you. And certainly, we have a broker team that can answer questions if there's questions about that. But some of the costs vary depending on the particular lens enhancement and so forth, and it gets a little challenging to work through those. But I will get you the plan summaries for the three plans that I showed briefly on the screen. And certainly, they can always call our broker support team to get questions answered, as well as the client. They can always call VSP once they buy a plan and ask them some of those questions. So
Awesome.
hopefully that helps.
Yeah, definitely. And I appreciate your time today, sir. And we look forward to working with you again.
Great. Thank you so much. Really appreciate it.
Take care.
Okay. Have a great day, everybody. Thank you.